Welcome back, dear viewers. We have been joined with our first guest for this evening, Dr. Mohammad Al-khamis, Assistant Professor of Epidemiology and Biostatistics. Hello and welcome, Doctor.
Thank you, and thank you for having me again.
It's our pleasure to have you with us on Health-Kuwait.
Yeah,
can you please tell us, how can we use the One Health system to study and explain the global pandemics such as Ebola and COVID?
So this is a very new, important concept that had emerged in the past 2 decades. So what is One Health? Let's explain it to the viewers. So One Health, basically any health phenomena, okay, or any health problem should not be addressed from one dimension. Health phenomena are so complex. Therefore, there are 3 basic dimensions in which we can assess the health phenomena. And health phenomena, like I said, the COVID pandemic, like Ebola pandemic, other types of phenomena like obesity, like diabetes, like heart disease. So this is basically called the triangle. The triangle, we see it from this triangle, which is animal health, human health, environmental health are interconnected. So basically here, when I see, for example, Ebola epidemic basically emerged from wild animals. And because of deforestation in the west of Africa and people consuming those wild animals, and the virus was jumping from animal to human and then back human. This jumping between 2 species actually what results in the emerging of infectious diseases like Ebola, like AIDS, HIV, like hepatitis, like this jumping is what actually initiate. And then we have environmental conditions that actually facilitate this transmission process, like weather, like soil, all of these environmental aspects. So this is where infectious disease, this is how they originate. So but you can see, and there is the human component, their health, their genetics. So basically here we have human health, animal health, and environmental health. And then basically the reason that we care about this, because when you want to solve a problem, you should solve it from the root. And you can see like the COVID pandemic. I always ask the people, do you think this is a simple health problem that can be addressed by one dimension? If so, we would solve it like a year ago.
Of course, there is many factors to it.
Exactly.
As you said, there are 3 factors, main factors, that are the humans, the animals, and the environmental. So whenever we're having a pandemic, we should look at all these 3 factors.
Exactly, and then the most important part is that with One Health, we should care. I'm as a public health worker or a professor, I should care about the health of everything. For example, I care about the health of the bees. Why someone in public health cares about bees? It's agriculture, it's insect, but bees population is dying out. And if bees population dies out, 70% of the vegetables, the crops, will disappear. So you're going to have a food crisis. And the food crisis will affect the human health crisis because there is no enough vegetables and fruits.
Yes.
So do you see this domino effect? So if I protect the health of the bees, I prevent this catastrophe from affecting the human health.
Yes.
So that's why I should always care about the 0 point to prevent the butterfly effect or the domino effect of this.
Of course. Doctor, can you please tell us how can the One Health system explain the transmission of dynamic of the recent Delta variant outbreak here in Kuwait?
Yes, so you can see here, so basically the Delta variant is a highly transmissible variant of COVID, and we have 2 types of, just to remind the viewers, there is an emerging variant and there is an endemic variant. Endemic variants, usually they cause casual outbreaks, and then they have also seasonal outbreaks like the influenza. Yes. And then we have the emerging variant, which is the Delta variant, and also the upcoming Lambda variant. Those basically cause severe outbreak, and what promotes their transmission is the environmental conditions. So if we notice what happened in Kuwait, we have an unusual whole week of dust storms. And COVID, one of the main routes of transmission of COVID is actually air, because it sticks to the dust particles.
Yes.
So the air, activity facilitate, and we breathe. You see, it's an air transmission, and we breathe again and again, and we gasp. And there is people with asthma and some issues, and this is where Delta hit very hard when we compare it to other. And then you can see also after the dust, we had additional 3 weeks of severe wind, which did not stop.
Yes.
But note, as weather experts said, by mid-July, this wind activity will go down. And you can see now the positivity rate of the swab substantially, it was like how much, 15, 16%?
Yes.
Now it dropped to 7%. immediately.
So the weather here in Kuwait is having a huge part in the spreading of this new variant.
Exactly, as well
Yes.
as pollution. When there is a severe amount of pollution in the air quality is bad. And you can see because, you know, outdoor or indoor, but mainly indoor. And also the other question is, if I'm staying at home, how this air activity affects me? Our homes are not sealed 100%. And actually does go inside.
Yes.
And that's actually the propagation of COVID. COVID transmission occurs mainly indoor, in a closed, poor air circulation, and that's where, you know, we can explain. And then there is, and you would ask me, where is the animal component here? Well, let's remind the viewers that COVID emerged from animals. Okay, you know, from, you know, there in China, and then basically there is also deforestation. Humans were consuming these wild animals or wild mammals, and the virus jumped again, and then it emerged into, and no one actually really monitored the situation to prevent the spread or emergence of COVID.
Yes.
Now, okay, now it emerged. Do we still care about animal health? I say yes, because now there are reports that companion animals, dogs and cats, they can get infected with COVID, and they could be potentially, the reports are not clear now, I would expect they will become major vectors of transmission without symptoms. Because why I would hypothesize, I mean, I discussed this with worldwide experts. We hypothesize this because MERS, which is the Middle Eastern Respiratory Syndrome,
Yes.
which emerged, you know, in East Asia and then came to the Arabian Peninsula, the intermediate host was camels. Okay, and because we have high population of camel, we were hit the hardest. And MERS is a deadly virus, caused a lot of mortality. So basically, companion animals or animals who get exposed with these virus germs, they would become potentially vectors of transmission. And you know, there are now countries starting even to swab and PCR pets to see whether they are positive or not. And actually, sometimes they give them some drugs that actually prevent the infection.
So animals can be the main reason, we can say, to spread and becoming the COVID-19. So we should beware, especially when we have COVID, to sit with our pets. Our pets are dogs, so they won't cause any other family members COVID-19.
Yes, I mean, that's potentially, not
Yes.
now. I mean, there is reports, and I would expect that might be soon, because, you know, this is, we are still seeing the dynamics. And then, you know, the virus is highly mutating, and because it has a high amount of jumps, and because it's from origin of wild animals.
Yes.
So why not the companion become the new vectors of transmission? And actually, they could also facilitate the emergence of even more aggressive, maybe, or new variants. So that's basically not just with COVID. Many viral diseases have similar infectious disease dynamics.
Yes, of course. Doctor, speaking of variants,
Yeah.
are there any upcoming new variants such as this Delta variant that are more severe in disease and more transmissibility? And if so, how can we prepare for it?
Yes, so that's a good question. So variants, I actually study COVID variants, comparative evolution. So viruses go under evolutionary processes that leads them to become a new variant. And the reason for this, basically, herd immunity that either generates from natural recovery, which is high recovery rate, 99% recovery rate from COVID, and then we have now the vaccination. It pushes the virus to mutate to become more transmissible, because when we are naturally recover or we vaccinate, we cut the cycle of transmission.
Yes.
And the virus, if it doesn't continue transmission, it will extinct. So part of its instinct is to mutate into different variants, and there are viruses who actually give up and extinct, but then there are viruses that are persistent, like influenza and apparently COVID. And let me tell you, for example, how this virus is highly mutatable. In the beginning of it, we had 12 variants. Now we have 26 variants, I think, or 25 variants. And yes, there is an upcoming variants like the Lambda. There is also Kappa, there is Eta. Now, the easy way to prepare for it is to achieve the proper vaccination coverage. So if we reach the 50% threshold of vaccinating the population, this is called the safe zone. And there is the guaranteed zone in which we advise to become 60 to 70%. So basically, and you can see there are countries, although the Delta variants were spreading highly in these countries, they were open and there is no masks They just coexist. It's like there is no COVID-19.
Yes, I've noticed a lot of countries, they don't have any restriction, and they are living their lives like normal.
So the key is vaccination. And I've heard good news from the Ministry of Health. There are huge amount of doses are upcoming. So once we reach this 50% threshold, we hope that we go back to normal like other countries, and this is basically the way to prepare. Now, the second way, which is important, disease surveillance. So I work also within surveillance activity, monitoring the variants, their behavior. We still have to continue, analyzing their genetics. Are there future outbreaks, and what would be the environmental requirements for those new variants to become more spreadable? The other question is that COVID, relatives in animals. Actually, COVID transmission dynamics in the human is similar to the ones in animals. So there is a family of COVID viruses that actually causing the food industry trillions of dollars a year. And actually, they say they actually control it.
Yes.
They produce vaccination, and then they do movement restriction between farms. So everything you see in humans was applied 20, 30 years in animals. Now, the problem is that once they started the first campaign of vaccination, which is easy to vaccinate animals, there are some part of those family of viruses did an event called recombination, in which it's a big genetic shift due to the high coverage of vaccine that resulted in various viruses that are highly, resistant to the vaccine. This will not happen yet with us. I mean, now the reports, the good news, all of the 6 vaccines that are actually recommended by approved by the WHO are effective relatively to all of the new variants. So even when I say like we have to surveillance the genome of the virus, I see that the amount of mutation are not really concerning. And the vaccine is still effective. The second dose even ensures that effectiveness of that vaccine. So this is basically the way how we
This
work
is
on
great news, Doctor. Thank you for this information.
Yes.
You mentioned something about the surveillance. What is the infectious disease surveillance, and why do we need it? Even if we manage to vaccinate the right amount of people and went back to normal life?
I really hope that someday we have a huge national surveillance program for infectious diseases and other diseases. So surveillance is basically the systematic collection of disease information with a pre-specified action. So let's say I've reached a threshold of COVID cases. I sound an alarm, and this alarm will have certain measures. So I do them immediately before COVID spreads out.
Yes.
Okay, so we set the threshold, and this is basically what's called a surveillance. We can do surveillance in time, we can do surveillance in space, we can also do surveillance in genomes. So when we reach a threshold of mutation, we get concerned, okay, we need maybe to fix the vaccination, like with the flu. They update the vaccination shots every 3 to 4 years because there are new variants. Also, there is clustering. In surveillance, we incorporate something, you heard about clustering of disease. So there is areas which has higher cases. So instead of me locking down the whole country, I can just lock down part that which we did with Mahboula and Jilib in the early day of the epidemic. That was basically they reached a threshold and they become so that's basically part of the surveillance activity. And by the way, surveillance not just for infectious diseases, also should be for chronic disease like heart disease, because you see, like for example, the chance of you dying from COVID as a healthy person, it's vaccinated, is less than 1%, but the chance of you dying from a heart disease is 20%. The chance of you dying from cancer is 15%. And those are actually global burden of disease.
Yes.
Until this day, even with the presence of COVID, by the way.
Of course, so people shouldn't worry about the vaccination because there are many side effects and many health issues that are much worse and scarier than getting the vaccination.
Exactly, and I mentioned this before, people who take hard drugs or diabetes drugs, they have a lot of side effects, but then those drugs save lives. But vaccines, they have minimal side effect. It's only, when you take it, but the thing is that, and it's only like 2 shots.
Yes.
And then you are done. Not like heart disease, which has like a list of complication and side effect, and you take it maybe for life. It's 2 shots, and I don't understand why people are scared from just 2 shots once. And after, actually, when we reach the 50 or 60%, and there is maybe an update in the vaccine, so it will be a personal responsibility. So the next stage is that if you have vulnerable people in your house, especially with kidney disease or heart disease and severe, you might want to vaccinate every year to protect them from getting infected. If not, it's your personal freedom not to vaccinate. It's like the flu vaccine. It's not obligatory. It's basically, I like to vaccinate the flu because I don't like to get sick, and I always force my household to vaccinate. And thank God, it's been 6 to 5 years since I, actually, dropped from the flu.
This is very good news, doctor. So if you have health issues such as heart or kidney, so you might be required to vaccinate even like once a year after the 2 doses.
Yes. Because I said this virus is not going anywhere.
Yes, just like the flu.
Just like we have to coexist. Once we reach a good vaccination coverage, we should stop being scared and be responsible. Instead of like hiding and getting scared, we should be responsible. We should assess the situation. Now it's, the government did their best in providing the vaccines and whatever care. Now it comes to personal responsibility and personal freedom in choosing what's good for you, and you are accountable for your choices at this.
Yes. Doctor, can you please tell us, some people are very confused and can't tell the difference between the science of epidemiology, virology, and infectious disease. Could you quickly and simply explain the difference?
Yes. So basically, epidemiology is the study of disease upon population. Virology is basically studying the biological characteristic of viruses, culturing them, their evolutionary processes, the proteins, their composition. And then
yes, thank you so much, doctor, for these amazing information, and thank you for being here on